Are you experiencing back pain that you can't get rid of? Getting migraines, vertigo, having trouble sleeping, and/or brain fog? Do you feel like your medical doctor doesn't understand your condition? Blair Chiropractic might be the solution you've been looking for. If you've ever been skeptical about this, the two doctors you're about to listen to were even more skeptical than you were when they looked into chiropractic work. But fear not. Get expert guidance from the blonde and the bald, Doctors Beth Bagley and Frederick Schurger. These two doctors have extensive experience beyond the healthcare realm and bringing unique vision and healing to their patients. What do you have when you get a biological analyst and an engineer together? Find out right here on another episode of The Blonde and the Bald. Welcome your hosts, Doctors Bagley and Schurger.
Good evening, Dr. Bagley. How are you?
Good evening. I'm doing well. It was a crazy last 2 hours, but it was fun.
Yeah, I am in the same boat. I had that new procedure that I'm doing.
Oh, yeah, it takes longer too.
It really does. I had two back to back while I was checking people out, and then I had new patient and his wife who's been a patient, and I had to get x-rays on both of them.
I know, right?
It's
fun. It's a good time. There was a moment in time we ran out of waiting room chairs. So
that's impressive.
Yeah.
That means you need more chairs.
Well, we could always pull more chairs in. It just means that I need to be faster.
Exactly.
Oh my gosh. Well, I have noticed a lot of my patients, and you probably have too, when they list out the drugs they're on, which a lot of people are interested, like, why do chiropractors care what drugs you are? Well, there's interactions and things. We don't put people on or take them off drugs, and none of this information that we're going to be talking about tonight is to tell you to stop taking something a medical doctor has put you on. But I think everyone needs to be informed about the things that they're on. And one of the things that we've noticed is a lot of people have heartburn, and a lot of people have been put on this drug called Prilosec or Omeprazole. Same thing, one's just the generic word. So we're going to keep calling it Omeprazole through the podcast, but just know it's the same thing as Prilosec, and it is an over-the-counter medication. And that is interesting to me because it is actually not that safe when you start doing the research on it.
And a lot of these things, a lot of these medications that we're talking about, it's not because, again, we're not taking you off of them, but it's because sometimes people are coming in with symptoms that may be directly related to taking these medications. So,
oh, for sure.
So when people are complaining about a given, statins was the example from the last podcast, that you have all of these side effects that are possible with it, and they're aches and pains, what we would consider musculoskeletal, that may or may not, the medical doctors might miss it because you're not there for, aches and pains. You're there for something else. And it just, you forget about it and you say, hey, doc, by the way, I have this. In fact, speaking of forgetting about things, I had a patient come in yesterday and he said, I've got a question on my testosterone. Here's my number. Is this low? And for some people, it's going to be low. And for some people, it's not. But unfortunately, I was running around doing some other stuff, didn't have a chance to address it then. And I had to give him a call a little bit later to say, no, it's for you. It's not low. It's probably, you are probably utilizing it because he's, a lean, healthy young man, versus somebody who might be, 15 pounds, 30 pounds overweight and saying, doc, do I have a problem here? It's like, absolutely. Now we need to figure out how to get rid of the extra weight because, again, certain medications have side effects. But let's talk about
Omeprazole.
Yes.
Yeah.
Thank you.
So when you have to practice saying, it is. It's also, I think, causing some pretty serious things in people. So this medication is, I'll read off of, thank you to Celeste, who is a student at Logan and also works in my office part-time, who helped me put this research together today. So thanks to Celeste. So GERD, people have heard of GERD, some people don't. Gastroesophageal reflux disease. So pretty much heartburn, but it's gone kind of crazy. Like heartburn, everybody's eaten like pizza and then laid down and been like, probably not the right thing to do. Don't lay down and eat pizza.
What's funny is as soon as you texted me earlier tonight about Omeprazole, whatever the word is.
Omeprazole.
My tongue is clearly not working tonight for that
Call
word.
it Prilosec.
But well, that's because that's a trade name. But any case, as soon as I saw that, my initial thought was, it'd be really good right now, pepperoni. I don't eat pepperoni, but I wanted pepperoni when I saw that word, and I'm like, why do, I don't know. Something about that word. As soon as I saw it, I said I wanted pepperoni, and now you bring up pizza, and I'm just like,
I'm telling you. But so like for some people, like red sauce, right, will
Yeah.
cause crazy reflux. People know their triggers. Like
yeah,
for me, if I eat sugar for more than 3 days in a row, I'm pretty much going to start getting heartburn. And the minute I go back on like a keto or a carnivore or something like that, it goes away within 24 hours. I don't have the problem anymore. But everybody's got their thing. It might be cheese, it might be whatever. But for some people, we have this reflux, and much of it is correctable if you just change your diet. But we won't go into that yet. So it's when stomach acid repeatedly, it keeps coming back up into your esophagus, and that can lead to some serious things like esophageal cancer and permanent damage. So in no way should someone have reflux all the time. That is really bad for you.
Right.
But maybe the answer isn't a pill every day. So we're going to talk about that. So omeprazole is a proton pump inhibitor, and it's used to manage or treat this heartburn or ulcerative. It could be ulcers, GERD, and then H. pylori. They try to treat it with that.
Right.
We can talk. I know we can talk a little bit about
we
H.
definitely
pylori.
need to talk. Yeah, H.
We'll
pylori
bring
is
it
one
up.
we need to come back to. Definitely.
Yeah, but in general, that H. pylori is a bacteria that causes ulcers in people. So it's a bacterial infection of the lining of the stomach. And it is something that is also treatable with interesting things like that aren't antibiotics and aren't omeprazole. Actually, in my opinion, omeprazole would make it worse, but let's move on. So the mechanism of action, it inhibits the parietal cells. So these are what makes the acid in the stomach. And it inhibits at the final step of stomach acid production. And when you take an omeprazole, it's not like, so if you take a Tums, right? A Tums is a base, like you're putting sodium bicarb pretty much in your body, and it's kind of taking away some of the acid in your stomach, but your stomach's still producing acid. This actually stops your stomach from producing acid. Maybe not 100%, but it definitely does somewhat. And you'll start having inhibitory effects of it within 1 hour of taking it, which is interesting. And it lasts for about 72 hours. It takes about 3 to 5 days for you to return to baseline. So if you took one Prilosec or one omeprazole, it would take 5 days for you to come back to normal somewhat.
Right.
But the effects of it, if you've taken it for a long period of time, the effects become more permanent, and it takes longer for your body to get off of it. So that's one of the things a lot of medical doctors will tell people is don't just stop taking it. If you've been taking it for a long period of time, it's not one that you can just stop. It's one that you have to step down off of because your body, go ahead.
What's going on with that? That doesn't make sense.
Yeah. So when people stop taking it suddenly, they will have such horrible pain, the reflux, that a lot of them will go to the hospital thinking they are having a heart attack.
Oh my.
So you can't just stop taking it. You're going to have to step down, and the slow taper is over the course of 2 to 4 weeks. The higher the dose that you've been on and the longer you've been on it, the slower and the longer the taper should be.
Right.
So you can all look up, you can Google that, or please talk to your medical doctor about how to wean if you are deciding to wean off of that. Again, we're not telling you to do any of that stuff. So side effects. Now here we go. So should I start with the scary ones first, or should I start with the less scary ones?
Let's start with most people are going to have commonly first that they might not realize is the problem.
Headaches. So headaches can be one. So we see a lot of headaches in our office. So that's one of the things when I see this one pop up on a medication list and I see someone with headache, I have to go, is it a neck misalignment? Could be.
Yep.
Or is this that you're taking this drug every day? Constipation. So a lot of people have that. They don't like to talk about it, but also diarrhea can happen too. So you can go either way.
Well, and I've heard some people actually say that constipation and diarrhea are two sides of the same coin,
100%.
whereas you still have you have stuff flushing out fast, but you still are impacted in one shape or form or another. So that makes sense.
Yeah. So let's kind of go through the mechanism of, let's say I eat a burger, right? Which has protein. Let's just say I'm just straight burger, not anything. I'm eating meat and I swallow it, but I've been taking Prilosec. I've been taking Omeprazole and my stomach doesn't have acid in it or has very low acid, right?
Yep.
So it's not bubbling up, but what's it doing to the protein? Because where does protein get broken down first?
Should be mostly in the stomach, right?
In the stomach by stomach acid. So the acid is breaking the long proteins apart into amino acids so that we can actually absorb the amino acids. Because our intestines can't absorb giant proteins.
Yeah.
They little pieces.
I mean, the intestine, most people don't appreciate this. They see guts, from certainly TV and whatnot, but you think about if you've ever butchered an animal, you see this casing that looks like the small intestine, and most people don't appreciate that the inside of that small intestine is one cell thick to be able to absorb stuff properly. So yeah, things have to be really small, and if things are too big, and this is getting into the leaky gut syndrome that a lot of people have, what that actually means is there's bigger gaps and larger things get in, larger things become an autoimmune issue because the body doesn't recognize it as either something friendly or self, and it starts attacking those proteins, which might turn into attacking your own proteins.
Yeah, so then we can even go into autoimmune stuff, but that's a whole nother topic.
Yep.
So proteins are supposed to be first broken down in the stomach. Now there's by the acid.
Right.
You don't have the acid. So now your body just kind of pushes through undigested protein into your intestine. Well, undigested protein, we got nothing there.
It's got no place to go.
Yeah. So that's where I think the constipation, the diarrhea come in.
Well, because those villi, the little fingers that are all over that help with the absorption and increasing the surface area, that leads to the possibility that they start getting impacted with stuff bigger than what is supposed to be. They don't let it pass through, but they also aren't able to absorb it. So you got a double problem going on there.
Yeah. So what's a vitamin B12? Okay, this is a whole nother part. Is where do you remember how vitamin B12 in the stomach? Do you remember that whole? There's like is it the parietal cell? Oh, I have to look it up.
Man, that's been a very long time.
I know.
Most of my brain thinks when I hear vitamin B12, I'm thinking, well, that's what you make. Your body can make it in the large intestine, given the right mix of stuff. So even vegans, because most of B12 is coming from food for most people who are eating some sort of animal product. B12 comes, you can make it, but it takes a very long time. So I'm not remembering this first part.
Okay, here, I got it. I figured it out.
Yeah.
So in the stomach, the acid of your stomach and enzymes unbind B12 into its free form. Right. So their B12 combines with a protein called intrinsic factor that's being made in the stomach, and then it can be absorbed like in the ileum into the small intestines. So if you're low on B12 or your body, if you're not getting enough B12, it could be because you don't have the stomach acid to digest it.
Sure.
Or to create it. So then you could do a couple things with the B12 deficiency there. You could take sublingually, or you might have to get B12 shots. But B12 deficiency, which is a side effect of this, can cause pain, tingling, numbness, muscle weakness, dizziness, confusion, concentration problems. So that's kind of a big deal.
Yeah. I mean, and again, common side effects, common things that are coming into our office.
Common issues we see.
I had the one new patient today. She said the worst thing she's got going for her right now are her migraines that would last the day. She can't even take a nap to get better, and then she's got to sleep. And then, as we were going through her findings report, she mentioned, will this help with brain fog? And I'm like, yes. And, you know, we see that commonly. But then I reminded her that she also has 4 young children under the age of 6. So, you know, that's part of, you know, unfortunately, that's part of being, having a family. I don't think it's even being
Absolutely.
mother. I think it's both sides of the coin,
No, it's
especially
hard.
when they're that young.
Having littles is hard.
Yes.
It's very hard.
So
now we've gone over obviously headaches that we see, stomach problems like diarrhea, and then we can have pain, we can have nausea and vomiting, we have gas, which makes sense because if your body's not digesting things correctly in the stomach and then it pushes it through, there's going to be bacteria that are going to cause some weird stuff and bloating in the stomach or in the intestine. So those were kind of the less scary things that can happen. Still pretty scary, but those are the less scary things. So this drug, if you read about it, it should be taken for a short amount of time. We're talking 2 weeks.
Yep.
Yet people and medical doctors, there's really good ones out there. Like one of my staff had a gastroenterologist say, whoa, how long have you been taking that? He goes, no, that's not something you should be taking long-term. We got to get you off of that, and taught her how to wean. So there are absolutely people who've done the research on this, but there are some people who just take it because it's on the shelf now and you can just grab it. I saw it at Aldi. You can get Omeprazole at Aldi. Yep. It's pretty awesome. Nuts. So you can get this anywhere, and people think, oh, it's just as safe as like Tums or, you know, a Tylenol.
Yeah.
And we've already talked about that's not that safe either.
Yeah.
But it's not like that. And so we're going to get into the scary stuff that can happen when you do take it long term. First one we're going to talk about is prolonged use of omeprazole can cause an increased risk by quite a bit of diabetes.
Ooh.
So that's kind of a type 2.
Yeah.
So let's see. And this is from an article in the Journal of Clinical Endocrinal Metabolic. I've never seen it spelled like that. Maybe it's from a different country. Anyway, it's from 2022. So it's not a long time ago that they did this. But regular and prolonged use of PPIs, which proton pump inhibitors, which is the omeprazole, is associated with a higher risk of diabetes. Physicians should therefore avoid unnecessary prescription of this class of drugs, particularly for long-term use. And that's the thing, is people just aren't seeing that. You know, if you're getting it prescribed to you and it's just a 2-week course of something, you know, I'm not super worried about it. But if you're just grabbing it off the shelf once a month and you're taking your 30-day supply of it, that's pretty scary, because now you have an increased risk of diabetes. So the other scary one that I'll go into some of the other ones: heart attack, stroke, liver disease, fractures, increased risk of fractures, C. diff infection. So that's that bug that is in the gut that when it takes over, it can kill people. It causes just the worst diarrhea, and it's super contagious. Hypomagnesemia, so low magnesium, which then can cause muscle pain, cramps, unusual weakness, fatigue, heartbeat problems, tremors, anemia, unusual bleeding or bruising, hypocalcemia, and then the last 2 scary ones I'll go over: dementia. So I want to find, here it is. So 2 studies, very recent studies, elevated risk of dementia and omeprazole. So why? I don't think they've done the why, but in older adults. So we're talking about older people. It's not like, you know, a 20-year-old on it's going to get it. But how will we know until they're, you know, 70, 80, 90 years old?
I mean, you mentioned brain fog.
Right?
So, you know, at what point in time does brain fog turn into dementia? You know, brain fog might just simply, you know, we call brain fog, you know, a symptom, but there's nothing other than what the patient's experiencing to define that. I mean, I have not seen anything for what brain fog would like chemically be, you know, in the brain. Is it just your things aren't firing and things aren't wiring together, or is it a pre-dementia type issue that given enough time could be a bigger problem?
Okay, so here are the numbers.
Yep.
The risk showed up after people use the drug for more than 4 years. And yes, we are seeing lots of people who've been on it for longer than that. People who used the PPI, the proton pump inhibitors, for that duration or longer had a 33% greater risk of developing dementia. That's a lot.
That's a lot.
So, and they did include Alzheimer's. So it's Alzheimer's, progressive brain changes. It's like they were covering all of the ones that had that. So that's Nexium, Prevacid, Prilosec. All of those are the PPIs, but Omeprazole is the Prilosec. So I think that's really scary. And the last one is gastric cancer. So it can cause stomach cancer, which is also scary. So when we look at that in general, this is something I don't think should be on the shelf. I don't think it should be on the store shelf. I can't believe it's on the store shelf, that people can just take it whenever and diagnose. And a lot of people wouldn't even tell you they're on it because it's on over the counter. Well, you weren't talking about when you ask about medications, you were just asking about what I've been prescribed. So I hope anyone that's listening to this at least does the research on it. Open up the Google, type in omeprazole and diabetes, omeprazole and dementia, omeprazole and liver disease. And once you start doing that, you're going to realize real fast that you need to be talking to your medical doctor about how to get off of that. And again, don't just stop taking it.
Yeah.
So the rebound hyperacidity is what they've termed if you stop taking it immediately, like you stop and you don't taper, it like rebounds with extra and you feel worse, which then makes you take it again. It's kind of like a drug, like a heroin. I know it's not actually like heroin. Everybody calm down.
But
let's see.
But it's a little bit like heroin because you can't. The worst part is it's sort of causing the symptom.
You're not wrong.
Making the symptom that you had problems with worse.
Yeah. So
because you can't function with it.
Yeah. So like most of the people get on something like fentanyl or heroin because they have pain of some sort, and it makes the pain go away. But if you stop taking it, now the pain is worse than when you even started, but in the beginning. So I see what you're saying.
I mean, it's not, but it sort of is.
It is. Yeah, or it feels that way. So how does chiropractic fit into that? Because we talk a lot about a chiropractic lifestyle. A chiropractic lifestyle is a lifestyle where you're looking at the cause rather than the symptom. Like we want to know why. So why do people get acid reflux? And I can at least speak to me is when I'm not eating properly, when I have, Christmas time or birthday, and then I just eat a couple extra days. It shouldn't just be one meal that throws you off. But if you're eating the standard American diet every single day, and everyone knows what the sad diet is, which is the burgers and the fries and the milkshake and the sugar and the sugar and the sugar, I will have heartburn every night, every single night. And that is no way to live. And the truth of it is, it still baffles me how quickly my body will get better after not eating that garbage.
Well, and you were telling me just the other week when I came down to visit that for Easter you had all the junk, and then within about a day and a half it was all gone.
Yeah.
So it was
2
fast.
2 days max. Yeah. So, and so many people, we're so addicted, I'm one of them, to sugar. I'm a sugar junkie, I will admit it, that once I eat a little bit of it, I just keep going after it, that you think you can't not eat it. Like your brain's like, I could never not eat sugar, or I could never fast for 18 hours, or I could never fast for 3 days. Our bodies are a lot of times when people say, oh, you've done a fast before. And I was like, yeah, I've done 3-day fast multiple times. Yeah. And they're like, how did you do that? And I was like, well, you just don't eat for 3 days.
Well, and this goes back to what I found for people who had problems with the fasting. It's hard to do just straight water. And having 3 equal parts, your sea salt, your baking soda, and your potassium chloride, maybe throw some magnesium in there for good measure, or just, make sure you're taking it as a supplement. Yeah. You drink that, you sip on this all day long with that mix, you're not going to be too worried about food. It is not too difficult to do it. You just need to know what are the things that will help you to do that and to get there. But Yeah, it takes some work, it takes a little bit of dedication, but anyone can skip 24 hours of meals. Eat dinner tonight after you listen to this,
Yep.
and don't eat a meal again until dinner the following day. You will not die.
No, you won't. And the first time I did a fast, which was years ago now, there was a fear. And
Yeah.
I don't know what it was from, but there was an actual fear. I was like, I don't know how I can do this. I don't know if my body can handle this. I don't. And people will think you're crazy for doing a fast like that. But once you've done it, you realize, first of all, what my brain realizes, and it might be different than you, is that how much I think about food. And I really do think about food a lot.
I don't think about food at all, except for when I want beef and steak, and but I don't think about it.
See, I do. Like, I'm thinking
do
about
all the
right now,
time.
talking about food. I know. I think
I've got-
about like, oh, what's for dinner? I'm excited for dinner.
I've already planned my dinner 3 times in my head. I'm like, ooh, no, I'm not going to do that. I'm just going to I'm going to do my bacon and eggs, but I could have
That
chicken
sounds
wings.
good. I have bacon at home.
But I could have this.
Chicken
I could
wings
have
sound
that.
good. I'm
No.
having chicken wings on Saturday.
Have I planned what I'm going to, I'm going to Dallas this weekend. Have I planned what I'm having for dinner and lunch? And am I getting a rental car so that I can go to In-N-Out and not spend an extra, my In-N-Out meal will not be $60
We're talking
because of
about
Ubers.
the standard American diet, and you're
I
going
know.
right for that. But again, he's doing that one time, not every day.
Yeah.
And
yeah.
so that's why it's not all or nothing. And yes, you can do fasts and all that stuff, but in general, find out what your triggers are, what causes you to not feel good, and just stop it. Because I need the person listening to this to start looking at that as poison.
Yeah.
What is triggering you is a poison to your body, or you're allergic to it. Neither of those is true. We both know that those aren't true.
How about this? Did you hear about how Lunchables, Consumer Reports has basically said Lunchables have lead and cadmium in them. These are ingredients in your battery.
We're feeding our children that crap.
Yes.
And why are our kids the sickest kids that they've ever been? The kids are the sickest. There's so many kids with
obesity, type 2 diabetes. You can go down the list.
Chronic diseases.
They're getting
chronic diseases.
They are being given these proton pump inhibitors because they are having heart.
Oh gosh, absolutely.
And everything else. So
I believe they put the babies on this too. I'm going to look this up.
I think you're right. I do remember hearing that not too long ago. But I just heard another discussion about like how do you sort of clean stuff up. I believe it wasn't Jordan Peterson's podcast, but he was the guest for another medical doctor. I want to say a psychologist, American psychologist, who was basically saying you can't cure schizophrenia with the diet. And then he takes another step back and says, well, maybe you can. Because going carnivore, as extreme as that sounds for some people, heck, going vegan, as extreme as it sounds for people, either way, it's an elimination diet that you've eliminated the vast majority of stuff. The reason I like carnivore is it's a lot easier to stick to it without having processed foods. Your foods are very basic. It is meat and maybe some salt and maybe some spices. Whereas a lot of the vegan, even a lot of the keto foods.
They're trash. You can absolutely eat trash.
It is really easy to say, oh, I'm going keto and I'm going to have all the junk and processed stuff and with all the extra ingredients. This can still be a problem if that's the route you're going, because if it has more than about 5 ingredients, it's trash. So you can.
Gosh, isn't that true? God, repeat it for everyone.
If something has more than 5 ingredients, it is trash.
Yes.
It is absolutely, because that's what keeps it shelf stable. What did I see? Polysorbitol, I think.
Sounds delicious.
It does. And then I read the rest of what they were talking about, how toxic it is. Anyways, it was one of those Instagram posts that I saw for like a moment. I'm like, oh, that's lovely. Any case, eating real food. Now, where am I going for my fast food tomorrow? I'm going to In-N-Out Burger, where when they run out of fresh food, they close the store. I go to a barbecue spot. Oftentimes it's when they've run out of brisket, not Terry Black's. There's another one down in Austin that literally there's a line around the block And when they're out of food, they close, and they're done like at about 2 o'clock in the afternoon at the latest, because that's how fast they open at 11. They close at 2. Those are the kinds of restaurants you want to visit, where where the food doesn't have a shelf life. It's, In-N-Out only has a freezer for their ice cream. And that's about it. So again, make your choices as healthy as you can. But if you don't recognize an ingredient on something, it's probably not good for you. It's a preservative that you don't need in your body.
No, you don't. Okay. So let's say someone is currently having acid reflux and they're like, what can I do? So there are some supplements that can be helpful with that. So some doctors will say taking some apple cider vinegar can help. Now that's kind of silly, because you're like, I have too much acid. That's why I have this. Let me take apple cider vinegar that adds acid. Well, here's where we get into this weirdness, is that a lot of people have acid reflux because they actually don't make enough acid in their stomach.
Right.
So then you eat something, it doesn't digest well, and then it just bubbles up and it's gross.
Right.
So adding acid actually helps you digest the food better.
And that's with the meal is where we're looking at adding that.
With the meal.
In about 200 or 300 years ago, a common practice was digestive drinks. It would have been cocktail hour back in the day. And what they would do is they make up these herbal concoctions that would be helpful to help you get your digestions running better, so that when you sat down to eat, your stomach acid was at full force, ready to break down that protein. For a lot of people, this ends up being the problem. It's not that they don't have enough acid in their stomach. It's when do they have enough acid? Because oftentimes you'll have that meal, and then about an hour later, now you have all that acid reflux coming up. The problem is your body said, oh, I need to make acid, and a lot of it right now, but everything's moved through, and now but now you got the acid, so it shows up late to the party. So having that little bit of apple cider vinegar is going to be a great way to start that, especially if you're finding that that's your sort of pattern of acid reflux, that it happens an hour to 2 hours afterwards. Switch it up. Try to trigger that earlier so that you can make that you can digest that food.
That's a really good point. So some of the other one of the things that Erin, who runs my front desk, she does is she drinks aloe before the meal. She says it tastes really bad, but she finds that really helps her digestion, is aloe juice.
Sure.
So I've never tried it, so I don't know, other than I've heard from her that it helps.
Aloe's fantastic for so many things. My grandfather had an aloe plant, and I don't know what happened to it. I think somebody forgot to bring it in one winter, and that ended up killing it off.
Sad day.
I'm very sad that we don't have that anymore, because he had cultivated that thing from a shoot. But a lot of healing benefits of aloe all the way around. So
pretty cool stuff. Yeah. Papaya enzyme, which is something I used when I was pregnant with the twins. I had terrible acid reflux when I was pregnant. One of the reasons a lot of pregnant women will get acid reflux is because there's a baby sitting right below your stomach, and there's no space. So a lot of pregnant women that I see will ask, well, how do I get the acid reflux to go away? And I said, well, you have to have the baby.
Yeah. And unfortunately, when you have depending upon your body type and how big a baby you have, and you had 2, so
there's a lot in there.
Yeah,
my acid reflux was crazy during that time. Now, I probably was also not in good habits of if I would have been eating keto or carnivore at that time, I probably would have been better off, but I at that point was not in that mindset. So papaya enzyme was really helpful. It's just like a little tablet you chew up. It actually is really tasty. It's a yummy one. There's slippery elm, which is like a powder, or you can have powder tablets and stuff. That's also really good for your voice if you're a singer. There is DCL. I'm gonna try to say what it is. Deglycerinated licorice. Yes, I said it right. So DGL. That is said, I've never tried it, but it's something that is said, it's like a digestive. So something you would take before your meal. Some of the other things that I have found helpful are bile salts, bile acids, there's some digestive enzymes in there that just help with digestion in general. that doesn't necessarily help the stomach, but.
Right. But especially if you're having a fattier meal, that will help with that. That's why I do like bile salts in general. And usually they do pair them with some other stuff. And also, if you have had your gallbladder removed, you will not be able to make bile fast enough in the liver. So having a bile supplement bile acid supplement, or bile salt supplement, is definitely important, so that you can emulsify those fats and utilize the healthy fat that your body needs.
I agree.
Any others on that list?
That's about all I've got in there, but the just tips for someone who is going through acid reflux is.
I've got two others before we get to that.
I'll go for it.
We're on supplements. There are two different supplements that I like from Standard Process. One is called Zypan.
That one's fabulous.
Zypan is great. Do not chew this.
No.
Do not chew Zypan. Papaya enzyme might taste awesome. Zypan, no. Unless you don't like the person and then you tell them to chew it. Chew
it up.
But Zypan is a very quick acting. It's definitely, if you're in the situation where where you have that acid reflux an hour to 2 hours afterwards, Zypan helps with that. It actually is, I think it's it's a hydrogen donor.
Got it. So it also increases your acid.
Right. Because your acid is HCl, hydrochloric acid. And that helps.
I've heard that Zypan helps, like if you're eating a whole bunch of steak, like you might take that and it'll help you digest the protein in it.
That, if your body's not good at doing that, absolutely. Absolutely. And it's got a couple of other things in there that help with that. The other one I've got is from MediHerb, which is their herbal line from Standard Process, and it's called Digest. And I'm just going to go through some of the ingredients in here, because these are things that you might make out of a tea if you can't get this directly. The first one is dandelion root.
That's good for your liver too.
It is good for your liver. And it's got tangerine fruit peel. Milk thistle's the next one, which is also good for the liver. In fact, it's a really good liver detox. It's got ginger rhizome, gentian root.
I love gentian root.
Have you had
what that is?
Okay, I figured you were
no idea.
Then it's got some tangerine and some chamomile. So these are, oftentimes if you're having a problem, you can find these herbs as a tea at a lot of stores now.
Yes, so, I've seen those digestive teas. So that's really cool.
Right. So that's another idea that you can, as far as supplements that you can try out if you are having this problem, especially if you're trying to wean yourself off of the medication, adding in something like Zypan. In fact, I carry Zypan and what's the other one? My trusty travel bag is right here. But I carry some Zypan and I carry some Zypan and Cholecol, which is their bile acid.
Oh, nice.
Now I don't know. I might have a mess of powder because I haven't opened them in a while. But I still have them just in case. But in any case, you had said some other dietary changes.
Yeah. So these are more like habit changes. So
yes.
I want to know how you feel about this is, right before we go to bed or, even 2 hours before we go to bed, how much energy do we need?
Right. And
probably not a lot.
Exactly.
So many people, like standard American diet, dinner is the biggest meal of the day, but it doesn't make sense.
Well, you got two problems. So not only is it our evening meal being the biggest meal of the day, but it is getting later and later. It used to be you'd have that evening meal 5:30 at the latest. I'm looking at the clock right now. It's 7:20.
And then neither of us have eaten dinner.
Exactly. And, it'll be 8 o'clock by the time I sit down, eat my eggs and bacon. And at that point in time, half the reason I choose an eggs and bacon meal is because it's light and it's easy on my gut. So that when I have it, I'm not overwhelmed. Yesterday I had 6 eggs. Today, I think I'm only going to do 4 because I haven't really, I haven't pushed myself to need that extra protein today. Plus I had, about a pound of beef and a couple chicken wings at lunch. So I focused on making sure I had more protein earlier.
Exactly.
And you're getting right to the right point that we need to focus on a bigger meal earlier in the day.
Yeah, like lunch.
Yes. Well,
Lunch should be bigger.
Whatever your first meal is, should be your big meal.
Yes,
So
and that's what, like, even if you haven't eaten until lunch, which is typically what me and you, I think, do, is we don't eat breakfast.
But it's break fast is that word.
That fast, yes.
And when you realize that first meal, you should load up on protein. You should load up on all the stuff you need for your energy. Because if you're eating a big meal and then you sit down and lean back in your recliner for a couple hours and then go right to bed, yeah, you can digest all that food, but that's a lot of work your body's got to do when it really wanted to do other cellular healing.
Yeah, it just you're at 9 or 8 o'clock at night. Neither of us need a big meal.
No.
We're both going to eat, and I'm not saying we shouldn't eat.
Yeah.
I'm just saying we don't need the biggest meal of the day to be at 8 o'clock at night.
Right.
And we should probably, in general, people should stop eating after that meal. Like if it's 5 or 6 o'clock, there's no reason to have another snack at 8 o'clock. Now, is it delicious to have some ice cream at 8 o'clock at night? Yeah.
Yes.
That sounds wonderful.
It really does.
But there's nothing going to help your body eating at 8 or 9 or 10 o'clock at night. None of those things, nothing has to go in your mouth, because all that is doing is first increasing your likelihood of having GERD or acid reflux.
Yes.
But also, we don't need the energy to sleep. We need the energy during the daytime. So when we break the fast, that's when you eat your big meal.
So let's talk about two things on that. So as we've talked about in the past, I wear this Oura ring that tracks my activity, sleep. One of the things that I look to is something called heart rate variability, which is really my autonomic operating system. It's telling me how well my nervous system is working as it communicates, and they can measure that off how the heart is beating. When I have a bigger meal late, if I have so yesterday I had probably about a pound of hamburger at lunch, maybe a couple chicken wings. Then I made chicken wings, so I had extras. So maybe I had chicken wings, 2 or 3, right? And then for dinner, I had 6 eggs and bacon, and then half a keto brick throughout the day. I wake up this morning, felt like I got a good night's sleep. But my heart rate variability was on the low side for me. Not quite in the tank, but definitely not in a great spot. And what's funny is but I feel good. And then I start talking to my patients this morning, sort of like when we started tonight, where I couldn't, Omeprazole. Hey, I said it.
You said it.
But I couldn't get words out earlier. At one point in time, I told somebody, all right, we're going to see you February 2nd. And she's like,
that's a really long time away.
Doc, do you mean May? And I'm like, yes, I do. I don't know why February came up, other than I looked at May 2nd, and I apparently I'm having some sort of weird dyslexic. I looked at the 2 and I said, second month, that must be what the word I want to come out with. So, I am not working at my optimal level. But when every time that I take, either I'll skip a dinner and then I'll sleep, go to sleep, and wake up the next morning, I'll see that number go up every time. So if I skip dinner, or if I do that 24-hour that I mentioned earlier, where I eat dinner and then don't eat again till the following evening for dinner, I will see that number go up that night, because I've got a meal in that my body needed and was able to utilize immediately, opposed to 2 meals broken up. So this is one of those things where, what does your body need? And we were talking about fasting. We are designed for feast and famine.
Yes, 100%.
And oftentimes we live in a society where we can feast every night. We are.
Eat lots of small meals. I think that's the worst advice you could give someone.
I don't think there's any good science. I think the science is showing that that's garbage. It's spiking your blood sugar, if nothing else, which means your insulin's still high. And all these people who are with high A1Cs trying to get it down so they don't have to be put on diabetic medications are, I'll eat 6 a day and I'm going to eat a lot of these heart healthy carbs, all the stuff that is out there that we can eat and eat and eat and eat and eat. So it doesn't.
Yeah,
It doesn't serve us.
you're right. Is the biggest. So the advice I can give someone is try intermittent fasting.
Yep.
Do not eat your biggest meal before going to bed.
Yep.
Have dinner, but don't make it the big meal.
Yep.
Focus on protein as your source of fuel. Proteins and fats are going to be a way better source of fuel than carbs.
And always
sugar.
prioritize eating your proteins first.
Yes.
If you're going to eat your meat and your veg and your salad should be the last thing that you eat, but everybody eats that salad first, which takes up space that doesn't, and your body doesn't really use that stomach acid to break down. You're using up that stomach acid to break down vegetable matter,
and that doesn't need to happen there. Yeah,
it does, and it doesn't need to happen then. The first thing you should do is do the protein, so that your body can utilize the stomach acid that is present, and then eat. If you're going to eat salad, eat that last.
That's a good point.
So, but or be like me and just say, well, the cow ate my salad, so
it did, and then I ate the cow. It's delicious.
Exactly.
Delicious.
Somebody fried up they decided to make a salad. So they fried up a pound of bacon and diced up and chopped and then poured that into a bowl and then proceeded to eat that bowl of bacon. And they said it was the best salad they ever had.
It's in a bowl. It's a salad bowl of bacon.
Yes, exactly.
So another thing is alcohol can kind of make the thing called a sphincter, which is what closes our stomach from, it can actually make that loose. And so alcohol can increase your likelihood of GERD. So decreasing your alcohol or eliminating it, especially at nighttime, probably a good idea. Smoking cigarettes can increase GERD. It also reduces the body's ability to neutralize stuff, and the sphincter can get weird with smoking. So smoking in general, we all know, is not that great for you. So just don't do that. And then if you are having really a rough time with it, and you've done everything right, you can sleep a little bit propped up. I wouldn't recommend that for a long term, but to get through a bad night, it can help you not have that reflux at that moment so that you can get some sleep. But again, if you're having to do that every night, we need to look at the why, not so much that's the answer isn't sleeping propped up every day.
Yeah. Absolutely.
So I think that's all I got on omeprazole. Pretty much headaches, constipation, gastric cancer, dementia, fractures, stroke, heart attack. It's just fabulous. It's good. It's a good time.
Yeah. It find better foods, and like I said, take Sunday night, eat your dinner. Monday morning, don't eat again till that evening, and you'll be amazed at how much better you feel.
Giving your system a break. It's a little break. Yeah. And we were humans. We did not evolve into where we are now by eating 3 square meals a day. No, that is not how it works.
It never existed. It never existed in reality prior to the turn of the century of the I suppose that was the 20th century. So it was.
Yeah, and now look at us. We are fatter and sicker than we ever have. 3 squares is not working. No, it's not working, guys.
And six small is not better either.
Absolutely not. It's not. Okay. Well, where can they find you, Dr. Schurger?
I am at Keystone Chiropractic in Springfield, Illinois, KeystoneChiroSPI.com, and some version of that on all the socials.
You can find me on most of the socials too. On TikTok, I'm at Dr. Beth Bagley. But you can find me in St. Louis. I'm at on the west side of St. Louis at PrecisionChiroSTL.com. That's Precision Chiropractic.
Awesome, folks. We'll be back in another week, hopefully. We've had some hiccups in our schedule, so if we miss a week,
just know we'll be back.
Make sure you're on. You've got auto notifications on. Like, subscribe.
Please do.
Send a 5-star review. Send a 1-star review. Heck.
Yeah, we'd like to reply to that.
We'll
just
say
review
hi.
us.
Yeah. All righty, folks. Have a good one, and we will talk to you in a week.
That's all for today's episode of The Blonde and the Bald. Don't forget to like, share, and subscribe. If you enjoyed today's show with Drs. Bagley and Schurger, remember, don't give up and just live with the pain. Come back next week and get more answers and solutions. Visit our websites at KeystoneChiroSPI.com and PrecisionChiropracticSTL.com for more info, and catch all the episodes of The Blonde and the Bald.